Welcome to the Changing Health Norms webinar. This webinar will prepare you to fully participate in the upcoming Improving Public Health Through Policy Change 2-day conference on August 27th and 28th. Through the Public Health Policy Initiative, county and state health department staff will be working with local community stakeholders to implement strategies focused on 5 areas: procurement practices for healthy foods, healthy community design, school health, healthy work sites, and clinical care. Embedded in each of these areas is ensuring responsiveness to the needs of children, youth, and young adults with special health care needs. Public health workers are highly skilled at disseminating health information, promoting healthy behaviors, and training community members in skills to reduce health risks. These services produce positive results for individuals and small groups. The Public Health Policy Initiative will give public health workers the opportunity to use their knowledge, skills, and experience to instigate changes in larger population groups. In this role, public health workers will further their understanding of the public health of local communities, recruit, convene, and train stakeholders, assess community readiness to change current policies and practices, facilitate the development of strategic plans to change policy, and help the stakeholder group connect to community members who have the position and authority to make and reinforce new community practices. Changing public health norms requires changing individual behavior and changing conditions in the community that shape behavior. We will give examples from the tobacco use prevention, school health, worksite wellness, and injury prevention arenas. So let's get to it. During this webinar, we will guide you through the steps to changing the conditions that hinder the health of your community. As a community health professional, you are tasked with identifying and seeking solutions to public health problems such as the presence of non-communicable and chronic disease, preventable injury, and early death. One of the first steps to finding a solution is to reach into the community to see what others are thinking, saying, and doing about the problem. A community may be defined as a social group of any size whose members reside in a specific locality, share government, and often have a common cultural and historical heritage. Members of a community perceive it as distinct in some respect from the larger society within which it exists. A complete assessment of a specific public health problem includes securing data about the physical, social, and economic effects on individuals and the community. The assessment process will help you identify key stakeholders. It will also help you gauge the community's readiness to make a positive change. When you convene the stakeholder group, you will assess their knowledge, skills, position, and authority. This will help you identify who you need to add to the table to achieve long-term success. You will facilitate the stakeholder group to identify the best strategies to address the problem in your community. Then you will develop a strategic change plan and an implementation timetable. It is helpful to find a champion within your stakeholder who will be the face of your effort when the action begins. Over time, the stakeholder group will assess the problem again and make mid-course changes to the action plan to ensure achievement of your objectives. With strategic planning and sustained action, new or revised policies and practices will result, and with consistent attention, the adoption of new community health norms will become a reality. It's like putting together a puzzle. The right fit takes time, patience, and perseverance. Public health professionals are skilled at increasing the public's knowledge and changing attitudes with the ultimate goal of changing behavior. Let's apply this method to a specific issue: tobacco use. Professional and lay health advocates around the state conduct knowledge and skill building activities with diverse groups with the goal of preventing the onset of tobacco use, helping tobacco users quit, and establishing family rules to safeguard children. Important results occur from these interventions. Participants demonstrate increased knowledge and skill. For those who were already against tobacco use, their attitudes and behaviors are reinforced. Evidence-based cessation programs generate successful quitters. It is challenging, however, for health advocates to reach a large enough number of people with sufficient dosage to achieve change in social norms using these tactics alone. Remember this parable? A man and woman are fishing downstream. Suddenly, a person comes down the river struggling for life. The fisherfolk pull her out. Then another comes and again must be rescued. This happens all afternoon, and the fisherfolk are getting very tired from constantly pulling people from the river. Eventually, they think, we need to go upstream and find out why so many people are falling in the water. When they go upstream, they find that people are drawn to the edge to look at the river, but there is no safe way to do this. Many of them fall. The fisherfolk go to the community leaders and report the number of people who have fallen into the river. They also report that this is due to the lack of a protective barrier on the cliff. Community leaders build a wall behind which people may safely view the water. Some still fall, but there are many fewer victims to rescue. If the townspeople had decided only to teach people how to stay away from the overlook, we could call that health promotion. It would be effective with all those who completed the training. The building of the protective barrier is an example of an environmental change that is an important complement to health promotion. In the early 1990s in Tucson and other Arizona communities, health advocates decided that people were being placed at an unreasonable risk of harm from secondhand smoke in restaurants. A multidisciplinary group of health promotion professionals, businesses, law enforcement, academic institutions, and youth and adult advocates gathered support from individuals and groups who had the position and authority to effect policy change. These individuals became the effort's champions. The stakeholder group decided to pursue a ban on smoking in restaurants. There was a backlash from business owners who were afraid that the ban would hurt their business, and the tobacco industry provided resources to fight the proposed ban. The stakeholders didn't give up. They continued to gather support from the community, and eventually the legislation passed in the Tucson City Council in 1997. 15 years later, it is difficult to think of the time when you had to choose between smoking and non-smoking section of a restaurant, and there is documented proof that restaurants were not financially harmed by the ban. How many people remember the prominence of cigarette vending machines, of smoking on airplanes, of school personnel smoking in teacher lounges, of people smoking right outside public buildings? To achieve sustained community impact, the individual and small group training and skill building activities must be combined with changes in the environment, the setting in which the unhealthy activity or behavior occurs. Policy change takes time, patience, and perseverance. Community impact happens when a group or groups of people with knowledge, skills, position, and authority use a strategic action process to address a community health concern. As Margaret Mead has been quoted, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." In the 14 years since the end of this timeline, the excise taxes on tobacco products sold in the U.S. have continued to increase, and the adult per capita cigarette consumption rate has continued to go down. A comparison between 2005 and 2010 smoking prevalence rates showed that the percent of adults who were current smokers went down in all age groups except those 65 years and older. The Family Smoking Prevention and Tobacco Control Act will continue to implement new regulations as far as 2015 in order to reduce the negative health impacts of tobacco use. Australia now requires tobacco manufacturers to have plain packaging. The only part of the pack that can be in color is the warning label. As you prepare to positively influence public health, it is important to know the facts. How many people are impacted? How are they impacted? How is the community impacted? Why does it matter? What are the barriers to change? This preparation will help determine where to begin the change process. You will figure out what needs to be changed and by how much. You will begin to identify the strategies that will harvest incremental change. Start with the low-hanging fruit. The selection of strategies will depend on the stakeholder group's knowledge, skills, position, and authority, and on the community's readiness to make a change. It is important to know what policies and practices exist in the community that shape members' attitudes and behaviors. Sometimes policies exist, but they are either not enforced or not enforceable. It is critical to be familiar with best practice methodologies for addressing the health problem in your specific community. An experiment in one community demonstrated that moving healthy foods that had been displayed in the back of the store to the front, where the less healthy foods had been prominently displayed, changed customers' buying habits. Purchases of the healthier foods increased. Remember, When policies already exist, sometimes the most efficient way to improve public health is to strengthen the policy rather than legislating a new one. While defining the public health issue in specific terms, think about what the problem looks like right now. Think about the physical environment and how it may contribute to the problem. Think about the current policies and common practices. Think about how the current social practices are enforced or reinforced. Next, describe the ideal. What would the physical environment look like? What policies would be in effect? How would enforcement or reinforcement of the policies and practices be realized? Then, describe how to get from the current situation to the ideal. What will it take to change the physical environment? What will it take to strengthen current policies or initiate a new one? What will it take to enforce the new or strengthen policy? Write down what you've learned. What is the issue or problem? What would be the ideal? What are the current policies? What do we have to do to get closer to our ideal? Earlier we mentioned community readiness. Readiness is defined as the degree to which a community is taking steps to address a particular problem or promote a specific health behavior. You might find that the community is unaware of the problem or has vague awareness. This is stage 1 of readiness. Some who perceive a threat to their way of life might come across as in denial or resistant. Remember that cultural beliefs, customs, and norms shape people's point of view toward a problem, which may be perceived as resistance when it really is not. The goal of the public health worker in this first stage of readiness is education and skill building and getting a deeper understanding of the role of culture in the community's perceptions and actions. The second stage of readiness is when people in the community are recognizing the problem and have varied degrees of knowledge, skills, position, and authority to do something about the problem. During this stage, community members are gathering facts and information, presenting ideas, determining strategies, and identifying resources to address the problem. At this stage, there are usually enough local stakeholders who are willing to plan and act. The goal of the public health worker is to assist with gathering data, facilitating discussions and planning, recruiting stakeholders, and building members' capacity to affect community change. In the third stage of readiness, the community is actively pursuing their ideal. The stakeholders are interested in establishing community ownership of maintaining the new norms through the institutionalization of policies and practices. The goal of the public health worker is to assist with reviews of the strategic action plan, facilitating discussions of new data and the need for mid-course changes in the plan, and assisting the group with institutionalizing policies and practices. How do you know you have the right people at the table? In thinking about who you have at the table, consider, do you have people who have been personally impacted by the problem? Do you have professional and lay health leaders who have knowledge and skills for planning and action? Do you have community leaders who may be part of establishing or enforcing new policies and who have position and authority? Do you have people who perceive the change as a threat? Think about business leaders, media, school leaders, youth-serving organizations, law enforcement, religious or fraternal organizations, civic and volunteer groups, healthcare representatives, government agencies, and other organizations you work with. It is important to have stakeholders who possess knowledge about the health issue and the factors that contribute to the problem and the solution, skills to affect community change, community position to catalyze a change movement, and the authority to lead and enforce organizational and legislative change. Here is an example of how stakeholders might support a worksite wellness improvement strategy. The evolution of child car seat use in the United States demonstrates the importance of using a combination of public policy, law enforcement, and public health messaging to save lives. Believe it or not, the first child car seat was invented in 1898. Its purpose was just to stop a child from falling out of the vehicle. A slightly improved version was developed by the Bunny Bear Company for 1933 Ford cars. In 1962, the first rear-facing child car safety seat was invented. It wasn't until 1966 that the American Department of Transportation enacted safety regulations requiring the use of the safety seat in all vehicles. By 1984, roughly half of the American population under the age of 4 rode in a child car safety seat, and all states had a law requiring use of the safety seat for children. In the late 1990s, there were reports that more than half of child occupants ages 4 to 7 who were killed in car crashes were totally unrestrained. In 2000, Partners for Child Passenger Safety began to publish its findings in peer-reviewed literature, providing advocates with a springboard for action, scientific evidence to help support their efforts to upgrade 20-year-old state child restraint laws to include booster seat provisions for older children. According to the Partners for Child Passenger Safety, booster seats can substantially reduce the risk of death and injury to children through age 7, yet only 19% of children in this age group are using them. Alarmingly, most of the children in that age group are being put at increased risk of injury or death due to inappropriate restraint in adult seat belts or lack of restraint at all. In 2012, Arizona updated its child safety seat laws to require that children ages 5 to 7 who are under 4 feet 10 inches tall to use a booster seat when riding in a car. This change was made possible because stakeholders with knowledge, skills, position, and authority work together to address a public health concern through policy change. This, of course, is not the end. Automobile accidents are still the leading cause of death and acquired injury among children. Parents and caregivers need reminders about the importance of safety seats, education to properly use car seats and boosters, and resources to obtain car seats. Public health professionals are well positioned to initiate and sustain these community efforts because they have knowledge about public health issues, skills to educate community members, and position to convene stakeholder groups. In this webinar, we have talked about the benefits and limitations of public health workers focusing solely on health promotion. Public health promotion targets individuals and small groups. The public health worker is the issue expert, trainer, and information officer. It uses best practice methods to change knowledge, skills, and attitudes toward individual behavior change. It can be implemented relatively quickly with good success with qualified trainers. It is difficult to maintain without ongoing funds, and the responsibility for producing change tends to be placed on the public health worker. We have demonstrated how public health workers can parlay their health promotion work into instigating and supporting policy change and its benefits. Policy change targets stakeholders and policymakers. The public health worker is the issue expert, trainer, and facilitator. It uses best practice methods to increase stakeholder knowledge, skills, and readiness to change factors that shape community behavior. The public health worker teams with stakeholders with position and authority to adopt and institutionalize new policies and practices. The responsibility for producing change tends to be placed on the community. It takes time, patience, and perseverance and has fewer ongoing costs. And it changes the conversation. Public health workers can position themselves to serve as catalysts for changing community health practices and norms. To do this, they will need knowledge, for example, about the legislative process, effective practices, issues, and local data. Skills, for example, as a strategic action planner, change agent, convener, trainer, and community stakeholder resources that they can tap into, such as community knowledge, community skills, community position, community authority. You will have opportunities on August 27th and 28th to learn about and discuss how other communities around the nation have successfully championed public health change. We hope that this webinar has provided you with some helpful information as you prepare for the Public Health Policy Training Workshop on August 27th and 28th at the Black Canyon Conference Center. Our workshop trainers will be Change Lab Solutions out of Oakland, California. Change Lab Solutions, formerly Public Health Law and Policy, works with communities toward the goal of everyone having nourishing food, safe places to live and play, plenty of opportunities to bike, walk, or take transit, fresh water, and clear air indoors and out. ChangeLab Solutions' expertise is helping communities establish good laws and policies that link housing, education, jobs, and the environment to healthy outcomes. Throughout the nation, ChangeLab Solutions works with neighborhoods, cities, and states to transform communities with laws and policies that create lasting change. Their unique approach, backed by decades of solid research and proven results, helps the public and private sectors make communities more livable, especially for those who are at highest risk because they have the fewest resources. ChangeLab Solutions has identified 8 elements of a strong public health policy. We encourage you to learn more about ChangeLab Solutions prior to August 27th by going to their website and attending their webinar titled Creating Healthier Communities Through Policy Change.